September is Ovarian Cancer Awareness Month, and nearly 85% of women with advanced ovarian cancer will face a recurrence of the deadly disease. This threat of recurrence often causes additional worry and anxiety in an already burdensome situation. However, recent advances in treatment of ovarian cancer may add another tool in the arsenal to battle this disease. Joining us now to explain more about the latest in ovarian cancer research and treatments is Dr. Robert Holloway and Ann, who will share her personal experience with the disease. Doctor, what can you tell us about the latest ovarian cancer diagnosis and treatment?
Good morning. Pleased to be here. What's really new is, as you stated, we have many more new treatment options for ovarian cancer. And while the vast majority of women who present with advanced ovarian cancer do have a recurrence of their disease, because of these treatment options, we have now approaching 250,000 women in the United States living with ovarian cancer, and that is new.
And what can you tell us about your journey after your diagnosis and your treatment?
Well, as Dr. Holloway talked, I am one of those women who was unfortunately diagnosed with ovarian cancer. What happened for me was I was experiencing excruciating pain, which led me to the emergency room and thereafter emergency surgery, at which point it was discovered that I had stage 3C ovarian cancer. Unfortunately, as many women, I did end up having a recurrence. And after the recurrence, my physician and I had many discussions about what was the best way to take care of myself. And through that discussion, it was discussed about maintenance therapy. And so that's why I'm here today with Tesaro, is to advocate for women and talk about options that we have for full and healthy lives.
Doctor, how typical is Ann's story?
It's very typical. A decade ago, we really didn't have many treatment options for patients like Ann once they had a recurrence and got back into a treatment remission. And it was basically a watch and wait for the next recurrence. Now, I might also prescribe a once-a-day therapy that can be useful in the maintenance setting to prolong remission, and that's Zejula. Like all drugs, Zejula has side effects, and it's important that you talk about the risks and benefits with your physician and advocate for yourself. For more information, you can go to Zejula.com and read about maintenance therapy yourself.
And what are some things you would tell other women who may be going through a similar experience?
Debbie, thanks for asking. That's a great question. So basically, everybody's experience is their own. Mine was different than maybe somebody else would have. The most important thing that I would say is that you have to be your own advocate. You need to ask a lot of questions, talk with your doctor, and make sure that you're aware that you do have options other than a traditional one. And if you don't like what you hear, get a second opinion. But definitely, it's not in your head, and listen to your bodies.
Doctor, what other advice can you provide to women and their loved ones faced with ovarian cancer?
I would merely like to echo what was just said by Ann, and that is, as a patient, you have to advocate for yourself. Do your research, talk to your physician, see a professional that treats ovarian cancer on a daily basis. There are many new treatment options, and we really appreciate the opportunity to talk to you today.
I'd like to thank you both for taking the time to talk with us this morning. Have a great day.
Thank you, Debbie.
Thank you.